everyone, and welcome to Facey's virtual sleep health class. And this is a great general education class on how to have healthy sleep. And just to let you know, we will be talking about good habits to help you sleep better and really focus on lifestyle modifications as opposed to clinical treatments, which a lot of you may have some conditions that require some medical or clinical treatment. But for this class, this is again a general education class, and so we won't be going in depth on certain medical treatments for sleep issues, but we are going to be focusing on the things that we control in terms of lifestyle. So just to let you know a little bit about me, my name is Tia Fernandez, and I am Facey's health and wellness coach, and I'm super excited to be sharing some sleep health tips that are evidence-based with you today so that you can improve your sleep from home. So let's get started. Okay, so here are some topics that we'll be covering today. We'll be doing sleep needs, the importance of sleep, benefits of sleep. We're also going to be discussing some risk factors for sleep, such as certain chronic diseases. And then the reason why you guys are watching this class in the first place, which is getting some tips on good sleep hygiene or sleep health. And at the end of class, I'll also be giving you some resources that will be helpful so that you can continue to be sleeping well. Okay, so sleep is actually a very important part of our life. It's so important that humans actually spend 1/3 of our lives asleep. And that's equivalent to 25 years of life. And contrary to popular belief, some people think that the brain does not, is not that active when we sleep, but that's far from wrong. The brain is actually very, very active during sleep. So let me ask you this. Do you think that adults need more or less sleep the older that we get? So I'm going to give you a little silence here while you think. Okay, I think that's enough silence. So are you on team more or are you on team less? Well, let's let Dr. Ann Wheaton from the CDC kind of school us on what is the proper amount of sleep as we age. So we're going to listen to an audio. Here we go.
This program is presented by the Centers for Disease Control and Prevention. Welcome to A Cup of Health with CDC, a weekly feature of the MMWR, the Morbidity and Mortality Weekly Report. I'm your host, LaToya Simmons. The amount of sleep we need each day depends on our age. Sufficient sleep is critical for maintaining good health. Dr. Ann Wheaton is a researcher with CDC's National Center for Chronic Disease Prevention and Health Promotion. She's joining us today to discuss the importance of getting enough sleep every day. Welcome to the show, Dr. Wheaton. Thank you for having me. Dr. Wheaton, are Americans in general getting enough sleep? Millions of Americans aren't getting enough sleep. More than 1 in 3 adults gets less than the recommended amount of sleep. But high school students are even worse off, with more than 2/3 getting less than what's recommended for their age. What is a healthy amount of sleep? Adults should aim to get 7 or more hours of sleep per night on a regular basis. Children and teens need more sleep, though. Infants spend most of their time asleep, although it's spread out over the day and night. As they get older, children need less sleep, but even teenagers need at least 8 hours. What can cause sleeping problems? There are multiple things that can contribute to sleep problems. Some factors are external, like work or school schedules. For example, people who do shift work or work multiple jobs tend to have trouble getting enough good quality sleep.
All right. Thank you so much, Dr. Wheaton. That was super helpful. And so now, did she answer, did we need more or did we need less? just to emphasize, Dr. Wheaton did say that as we get older, it actually depends on our age, but adults really need between 7 to 8 hours of sleep or more to get good sleep health. So now we're actually going to go over some California sleep facts. And this graph shows the prevalence of poor sleep among California adults. So it looks like 33.5% of California adults report usually sleeping less than 7 hours in a 24-hour period. And here, as you can see, it's color-coded, and the darker green indicates more percentage of people that sleep less than 7 hours. And if you look at the state of California, all of the dark green sections are usually around more of the metropolises, the big cities, the urban cities. So it could do with lifestyle that people are having less than 7 hours of sleep. So this slide shows per county those people who sleep 7 hours, less than 7 hours a day, not getting enough sleep. Okay, so now poor sleep, how poor sleep affects the body. So the body needs sleep because during sleep it builds and restores itself. So not getting enough sleep means that it can be dangerous to your health over time. So here are some of the effects of poor sleep over time. For your heart, you could develop high blood pressure, especially if you're at risk for high blood pressure. It runs in the family. Also, lungs. It can weaken the immune system, so you may be prone to more respiratory infections. It can also affect your mind, where you'll have low performance and slower reaction time, and it also can affect muscles functioning as well. Okay, so going back to what Dr. Ann Wheaton said, as Dr. Ann Wheaton from the CDC says, these are the recommended sleep durations. So remember when she said newborn and infants spend most of their time sleeping, the blue here on the graph indicates the number of hours that are recommended. And the teal indicates the number of hours of sleep that may be appropriate, but it's not the best practice. So we want to be looking at this blue area here. So for infants and newborns, between 12 to 15 hours. As we get older, toddler, preschool to school age, it looks like between 10 to 11 hours are great. Teenage years are going to be starting to have the norm, recommended 8 to 10 hours. And then when we're young adults, 18 and older, this is the recommended amount of sleep, 7 to 9 hours, okay? And then as older adults, it is recommended for us to sleep between the 7 to 8 hour range to really feel rested and rejuvenated. But we can survive to between 5 to 6 hours as well. Or if for those of us who are lucky, we can get 9 hours, more than 8 hours of sleep. Okay, so don't give up on your dreams. We want to keep sleeping. So now we're going to go into the science of the stages of sleep. So healthy sleep is made up of 4 cycles, of a cycle of these 4 stages. NREM stands for non-rapid eye movement sleep. And non-rapid eye movement sleep actually encompasses stage 1, 2, and 3. Then stage 4 is REM sleep, which is rapid eye movement sleep. I love visuals, and I think that it'll help us kind of learn a little bit more about what happens during these 4 stages of sleep. So we're going to go ahead and watch a visual as to what happens in these 4 stages, which are very important.
Every night, almost everyone on the planet is in unconscious thrive. But what is really happening? Sleep is regulated by circadian rhythm or body clock located in the brain. Body clock responds to light ramping up production of the hormone melatonin at night, and switching it off at night. There are 4 stages of sleep that the body experiences and cycles throughout the night. On a good night, we cycle through these stages 4 or 5 times. Stages 1 and 2 are night sleep. This is the transition from being awake to falling asleep. Heart rate and breathing begin to slow, body temperature falls, and muscles tension. Stage 3 is sometimes referred to as stealthy sleep because of the slow, stealthy brain movement that are released during this stage. This is the first stage, where our cells produce growth hormone, muscles, balance hormone, and pheromones. Stage 4, body creates chemicals that render it temporarily tired, so that we cannot act out on it. Brain is immediately active. Our eyes open up and start back and forth. Human time to spend 1/3 of their life asleep. One time zone, stress, and the proliferation of technology means that people are sleeping far less today than they were a century ago. Sleeping less than the hours today is associated with increased risk of development of chronic conditions, including human lifespan. So for a healthier lifestyle,
All right. Such great advice there. Okay, we're going to go back to our presentation here. I thought that was super, super helpful just to see the visual of the different stages of sleep. So just to review, non-REM stage is divided into 3 stages, 1, 2, and 3. Stage 1 is a very light sleep where you get awakened by little noise. Stage 2 is a little deeper sleep. Stage 3 is when your muscles relax, your blood pressure and breathing rate drop. And this is considered deep sleep, and this is important for restoring the body and mind. And usually stage 3 occurs after 90 minutes of you falling asleep. Okay? And then stage 4, this is rapid eye movement sleep. So the muscles are quiet and unable to move. And rapid eye movement sleep are important for learning and forming memories. This is actually a graph of the stages of sleep, and if we get 7 to 8 hours, which is the recommended, we actually go through 4 or 5 different cycles. So this shows the different cycles of sleep. We actually cycle through 1, 2, 3, 4, 1, 2, 3, 4, and these humps here indicate a completed cycle. So 1, 2, 3, and 4, and then we're here awake. And as you can see, this is the time of sleep from 0 to 7 to 8 hours recommended. Okay? So now these 2 stages, there are actually 2 stages that are probably the most important in terms of your health. And together, these 2 stages are called restorative sleep, which is stage 3, deep sleep. This is when you're hard to wake up. When you reach this stage, your performance enhances. And these 2 stages are the most beneficial for restoring your body and you feeling restful when you're awake. And then if you recall, stage 4, which is rapid eye movement sleep, this is also indicative of you having dreams or remembering your dreams. All right, so now we're going to go into the benefits of sleep. So indeed, we know sleep deprivation results in disruptions in cognition and memory deficits. And this leads to impairments in our abilities to maintain attention, make decisions, and recall long-term memories. So moreover, these impairments become more and more severe as the amount of sleep deprivation increases. So again, benefits of sleep, hormone secretion, important for growth, biological rhythms, also reproduction, definitely immunity, super, super important, especially nowadays, and cognitive function, improvement in attention, decision making, memory recall, and also, as the research suggested, more creative capacity, language learning, inferential judgment, and also being able to process emotions a little better. So sleep is super vital for health, performance, and well-being. So it's very, very important to get our beauty sleep. So while we're sleeping, your body and your skin are actually hard at work healing themselves. Yes, healing themselves. So during the deeper phases of sleep, you guys recall the deeper phases of sleep, which is the stage 3 and stage 4, your body produces growth hormone, which repairs daily damage from things like sun exposure and pollution and creates new cells so you wake up looking brighter, fresher, and more vibrant. So this gives our body enough time to rest and recover, and giving our bodies enough time to rest and recover is really the key to maintaining good health. So if you see, you can probably tell when a friend, a relative, or a coworker didn't have a good night's sleep because they may have, wrinkles, saggy skin, dark circles under their eyes. These are signs that maybe their sleep patterns are not very, very, very good, or they didn't have enough sleep that evening. But is just to emphasize that sleep is really an important part in having our body heal itself, and also improve our immunity. So make sure that you get enough. Okay, so here are some risk factors of poor sleep. So long-term insufficient sleep is associated with lots of chronic conditions, including obesity, diabetes, high blood pressure, coronary heart disease and stroke, and poor mental health. It also can affect our long-term daily lives. So one night can affect mood, productivity of work, and also increase your risk of getting into a drowsy driving crash. And about 70 million Americans suffer from chronic sleep problems. And lack of sleep is associated with injuries, chronic diseases, mental illnesses, poor quality of life and well-being, increased healthcare costs, and lost work productivity. Sleep problems are also major contributors to some chronic conditions, like we mentioned here, obesity and depression, but are very rarely addressed. So here are some risk factors, again, of poor sleep. Obesity, people who are obese are more likely to have poor sleep. Also, if you have an irregular sleep schedule, as Dr. Ann Wheaton said, like a night shift work, or if you travel internationally more often, you're more likely to have a poor sleeping pattern or poor sleep. Also, the older we get, age is also a factor. And there are certain lifestyle factors as well, like if you consume caffeine, if you aren't as active, if you're unable to manage your stress, and also if you are a smoker, this can all contribute to having poor sleep. So now the facts. This graph from the Centers for Disease Control shows that risk factors such as obesity, physical inactivity, smoking status, and excessive drinking contribute to having less than 7 hours of sleep. So as you can see, the blue indicates persons with obesity who have less than 7 hours of sleep, and the green shows people with obesity who report more than 7 hours of sleep. As you can see, if you're obese, you're more likely to have poor sleep. If you're physically inactive, you're more likely to have less than 7 hours of sleep. Also, if you're a current smoker, and the excessive drinking also contributes as well. All right, so this next graph shows the prevalence of chronic conditions by sleep duration. So many chronic conditions are more common among adults who sleep less than 7 hours compared to those who sleep more than 7 hours. If you look, there are some conditions here indicated with an asterisk. So an asterisk by each of these chronic conditions indicates that the prevalence or the commonality of that condition is significantly higher for adults who reported less than 7 hours of sleep compared to adults who reported sufficient sleep, which is more 7 to more hours. So again, those who have asthma, higher number reported less than 7 hours, also with chronic obstructive pulmonary disease. Also here, arthritis. You know, some people maybe aren't able to sleep due to some arthritic pain. Those with depression also have difficulty getting a good amount of sleep as well, and chronic kidney disease and diabetes. So a lot of these are chronic conditions that are associated with less than the recommended 7 hours of sleep. So now, the potential effects of sleep deprivation, either from regularly not allowing enough time for sleep or due to a physical or mental problem that prevents restful sleep, produces noticeable symptoms, including the following. So you might feel drowsy during the day. You may routinely fall asleep only within 5 minutes of lying down in bed for the night. You may also experience some micro sleeps, which are very brief episodes of sleep while being awake. And also, sleep deprivation can noticeably affect people's performance, including their ability to think clearly, react quickly, and form memories. Sleep deprivation also affects mood. So this leads to irritability, problems with relationships, especially for children and teenagers, and depression. Sleep deprivation can also increase anxiety. So, as we know, sleep is very important for overall health, and inadequate sleep is associated with numerous health problems. And research shows that not getting enough sleep or getting poor quality sleep increases the risk of high blood pressure, heart disease, obesity, and diabetes. And sleep deprivation can also be very dangerous because sleep deprived people who were tested using a driving simulator or performing hand eye coordination tasks did as badly or worse than people who were intoxicated, believe that or not. That was from a recent research study here. And drowsy driving actually causes thousands of car crashes each year, and some of them are fatal. So sleep deprivation magnifies the effect as well of alcohol on the body. So a fatigued person who drinks alcohol will be more impaired than a well-rested person. Okay. And I did want to go ahead and share another article here that also proves the potential effects of sleep deprivation, and we'll explain why we need sleep. So although sleep doesn't trump food and water in the hierarchy of physical needs, we actually can't live without it, can't. Given the ethical limits on research involving human subjects, scientists have no direct evidence on how extended sleeplessness, that is beyond a few days, affects human beings. Laboratory rats, however, have been deprived of sleep for long periods, and after a week or two, the results include loss of immune function and death from infection. And this last study here, in a landmark study of human sleep deprivation at the University of Chicago, the researchers followed a group of student volunteers who slept only 4 hours nightly for 6 consecutive days. This is super interesting research study when I had read this. So again, the student volunteers slept only 4 hours nightly for 6 consecutive days, and the volunteers developed higher blood pressure and higher levels of stress hormone cortisol, and they produced only half the usual number of antibodies to a flu vaccine. The sleep deprived students also showed signs of insulin resistance, a condition that is a precursor of type 2 diabetes and metabolic slowdown. But here is the caveat: all of the changes were reversed when the students made up the hours of sleep they had lost. So let me repeat that again. All of these changes were reversed when the students made up the hours of sleep they had lost. And the Chicago research helps to explain why chronic sleep debt, or sleeping less than the recommended amount of sleep, raises the risk of obesity, heart disease, stroke, and diabetes. Okay, so now going into some common sleep disorders. Again, this class is going to be focused more on the lifestyle modifications, but we wanted to touch base on some of the more common sleep disorders that Americans have. Number one, insomnia. This is the most common sleep disorder, and it is characterized by difficulty falling asleep, staying asleep, or waking up too early. There is also nocturia, which is frequent urination at night, and sleep apnea. Some of you may have this if you're listening to this education class on our site. But sleep apnea is, again, interrupted sleep by periodic gasping or snorting noises. Maybe you may know of a friend, a relative who may be sleeping with a CPAP machine. That's to help get oxygen to your body as you sleep with those people with sleep apnea. There's also movement disorders such as restless leg syndrome. This is very common among our veteran population, our veterans who have restless leg syndrome. Very painful, also uncomfortable, uncomfortable and painful. Moving the legs at night can always keeps them awake. And then there's also narcolepsy, which is an overwhelming daytime drowsiness. So now we're actually going to go and delve into a little bit about insomnia, since this is the most common sleep disorder that is common amongst Americans. So again, insomnia is characterized by trouble falling asleep or staying asleep or waking up too early in the morning. Anyone know of anyone like that? It might be you, it might be a relative, it might be a family friend. But this actually affects mostly Americans, and more than half of the people reported at least one symptom of insomnia, believe it or not. And it's more common in women and older adults. There are actually two types of insomnia. There's acute and chronic. And acute insomnia is basically caused by, this is just brief, caused by certain life circumstances. The scenario that I can think of, maybe college student who is not sleeping at night because of finals, needs to do studying, or even some stress with family or work that could cause some acute insomnia. And then there's also chronic or disrupted sleep, chronic insomnia, which is characterized by disrupted sleep 3 times or more per week that lasts at least 3 months. So you might be wondering, what is the treatment then for insomnia? So treatment for insomnia can include behavioral, psychological, and medical components, or some combination thereof. So you and your doctor will need to talk about your particular situation and history of insomnia, as well as its causes, to decide the best treatment plan. It is proven there is an evidence-based therapy if you were to go to a behavioral health therapist, and there is cognitive behavioral therapy for insomnia. This is the most effective treatment that's medicine driven to help with this, and it is led by a behavioral health specialist. Facey actually has a behavioral health department, and if you are interested in maybe exploring cognitive behavioral therapy, I would go ahead and ask your primary care physician if he or she can place a referral to our behavioral health department and specifically put in the comments cognitive behavioral therapy for insomnia, so that you can try this treatment option. It's a behavioral treatment option. Okay? And again, some of the medical components, you can talk with your medical provider on some sleep aids, and there are also over-the-counter sleep aids too, which some of you may know about as well. All right, so now what you've all been waiting for, the sleep tips. So now we're going to go over the 10 evidence-based tips for a better night's sleep. So are you guys ready? Okay, here we go. So this actually illustrates a sleep-wake cycle. So this is a full 24-hour period. The first way that we can help improve our sleep is really getting to know our own body clock. And a fancy word for our own body clock is knowing our circadian rhythm and understanding our own body's internal clock. So body's internal clock equals circadian rhythm, okay? And basically, understanding your body's internal clock or circadian rhythm is the first step to better sleep. So your circadian rhythm, also known as your sleep-wake cycle or body clock, is a natural internal system that's designed to regulate feelings of sleepiness and wakefulness over a 24-hour period. This complex timekeeper is controlled by an area of the brain that responds to light, which is why humans are more alert while the sun is shining and are ready to sleep when it's dark outside. So let's look at this circadian or this sleep-wake cycle here. As you know, it indicates some key things that are happening in the body here. So maybe as we wake up, when the sun shines, again, circadian rhythm is body's response to light, internal body clock. So as we wake up, cortisol secretion begins. Insulin secretion with first meal timing between this time here. You have elevated testosterone levels around 9 a.m. You're alert, super alert by 10. And your greatest cardiovascular and skeletal muscle strength is around 5 p.m. So if you want to do a workout at this time, that'll be a great little routine for you to do in order to help you sleep a little better and find a routine. You have peak lipid levels here at 6 p.m. There's a peak in body temperature and blood pressure around 7. There's peak neutrophil levels here at around 8. Then your body actually produces melatonin, its own melatonin. We know about the over-the-counter melatonin, but your body can actually produce this too, and it usually produces it around 9 or 10 p.m. Then we get ready to sleep here, where we reach our deepest stages of sleep. Remember, stage 3 and stage 4, which is characterized as restorative sleep here around 2 a.m. And peak lymphocyte levels. Anyone know what a lymphocyte is? Basically the scientific term for white blood cells. So again, remember, during restorative sleep, our body is working super hard to repair any damaged cells, but also helping boost and increase our immunity during this time as well. So that's only happening during the deepest stages of sleep, stage 3 and stage 4. Great. Okay, so again, we went over what circadian rhythm is. So delving a little deeper, your circadian rhythm causes your level of wakefulness to rise and dip throughout the day. So most people feel the strongest desire to sleep between 1 p.m. to 3 p.m., aka the post-lunch or afternoon crash, and then again between 2 a.m. and 4 a.m. But this can vary from person to person. So that's why some people are morning people, while others function best in the evening. So your circadian rhythm can also change as you age. When you were a teenager, for example, your body was programmed, so to speak, to sleep for more total hours as well as go to bed and wake up later. Okay? So if you follow your body's natural cues regarding when to go to sleep and wake up, your circadian rhythm should stay balanced. But a change in your schedule, like if you stay up late pulling long hours at work one day or sleep in one Saturday, it can disrupt your body clock. So what we do is we follow these 3 tips to keep your circadian rhythm functioning as it should. So number 1, we want to stick to a consistent sleep schedule. So a regular bedtime is one part of the equation. We want to do that even on weekends. But waking up at the same time daily will also help your circadian rhythm be in check. And it may be tempting to grab some extra shut-eye on weekends, but doing so can throw off your body clock during the week. And number 2, it says here to go for a morning walk. So in the morning, here we go. So in the morning, we want exposure to sun or indoor light. The indoor light won't just give you an energy boost, or the sun won't just give you an energy boost. It can also reset your circadian rhythm. And a quick outdoor stroll in the morning will give you enough sun exposure to signal your brain that it's time to start the day. But what if I don't have time to walk? You may ask. Well, if you don't have time to walk, just simply raise the blinds in your bedroom and around your home, or switch on your brightest light instead. That should suffice. So number 2, managing your circadian rhythm here. We want to be able to dim the lights at night, avoid bright light in the evening, because bright lights in the evening hours can throw off your body clock by confusing your brain into thinking that it's still daytime. And artificial blue light, the type that laptops, tablets, and cell phones emit, is the worst culprit. So try to power down tech devices at least 2 to 3 hours before bed. Okay, so laptops, tablets, cell phones, all of these emit that nice bright blue light, but that tells your brain that it's still daytime. So we don't want to do that. We want to limit the evening tech, and we want to use a soft light in the bedroom. When we do want to brighten the lights is during the day, so we want to expose yourself to sunlight in the morning and during daytime hours. That'll help you regulate your circadian rhythm and your body's response to light. Okay, so number 3, practice a relaxing ritual. Tip number 3. So a relaxing or routine activity right before bedtime conducted away from bright lights helps separate your sleep time from activities that cause excitement, stress, or anxiety, which can make it more difficult to fall asleep, get sound and deep sleep, or remain asleep. So these are some examples of some bedtime rituals. Some people like reading a book with a nice dim light at the bed, or maybe outside in the living room. Then when you come and feel yourself kind of falling asleep, that's when you enter the bedroom. Some people like to drink hot herbal tea with no caffeine. Make sure it's no caffeine, otherwise you'll be staying up. That also lowers the body's temperature and is able to relax the body. And again, you want to separate your sleep time from activities that cause anxiety, stress, or excitement, okay? And it is recommended, if you do take a bath in the evening, do so 60 to 90 minutes before bedtime to allow your body temperature to drop. Okay, and speaking of relaxing rituals, I thought it would be great for all of us to do a relaxing ritual together. One of the relaxing rituals that has been proven to be effective is doing your own mindfulness meditation. There are many apps that are on your phone that can guide you with this type of medication, but a lot of the times people cannot fall asleep because they're thinking about a lot of the things or a lot of the responsibilities that we have day to day. Our kids need this, and our family needs this. So many things that are running through our mind can't rest, and so then we're not relaxed, and our body is not ready for sleep. Instead, our mind is running, running quickly. So the what we can do is we can do a nice meditation to kind of relax our mind and focus on one thing as opposed to a million things that we need to do, and then that'll hopefully make us relaxed and be ready for sleep. So I thought that we go ahead and do a meditation together. So I invite you guys to maybe lay in bed or lay in your couch. Hopefully you're not driving or operating any heavy machinery at this time. This meditation is very short. It's about 4 minutes, but hopefully it'll get you into a relaxed state and a focused state so you can focus on, number one, just getting a good night's rest. So let's do this together. Go ahead and relax. Close your eyes. You can lie down or sit in your chair, or again, you can also sit on your couch or lay on your sofa and enjoy this meditation together by Dr. Deepak Chopra. Here we go.
The biggest reason for insomnia is actually worrying about insomnia. So anxiety about not going to sleep is the biggest cause of not being able to sleep. Lie in bed either on one side or on your back and try and be as still as possible. And remember one thing, that if you're still and lying in bed, your body gets almost the same rest as it would if it were totally asleep. Okay? So have the attitude that even if you can't sleep, you're getting the rest. That attitude will be very helpful because you won't be worrying about sleep. Okay, so let's say you're doing this now, you're lying on your side or on your back, and now gently bring your awareness to your breath and start becoming aware of your breathing as it goes in and out. You don't need to manipulate your breathing, just be aware of it. Okay? Just be aware of the breath as it goes in and out. If you hear any sounds, which you shouldn't because your room is soundproof, noiseless, or if you feel any sensations in your body, even thoughts intrude, just gently come back to your breathing. And now give your mind permission to settle into your breath. Let your mind become one with your breath. As you do that, you see this quieting of the internal dialogue. Let your mind become one with your breath. And now start repeating this mantra silently to yourself. It's actually a Sanskrit mantra which introduces a vibration in your consciousness that is good for sleep. This is a sleep mantra. So repeat mentally as I pronounce this mantra to you. Om Agasti Shayana.
Thank you so much, Dr. Deepak Chopra. I already feel super relaxed and hope you guys do too. So, again, that was a common mindfulness meditation to focus on our breathing, focus on one thing at a time, kind of ease our mind from the thoughts that we have and the different responsibilities that we have. So, that can be another way that you can practice a relaxing ritual. Okay. So, going on, step number 4, we want to turn off electronics before bed. So, your body needs time to shift into sleep mode. So, spend the last hour before bed doing a calming activity such as reading. And for some people, using an electronic device such as a laptop can make it hard to fall asleep because the particular type of light emanating from the screens of these devices is activating to the brain. But if you have trouble sleeping, you want to definitely avoid electronics before bed or in the middle of the night. So any light can suppress melatonin secretion. And melatonin secretion is, again, our body's natural sleep aid that we secrete, but especially blue light. Blue light is the one that suppresses the melatonin secretion. If you do need light, you would want to use dim red lights for night lights. Here is a example of a soft red glow. I believe that you can find this on Amazon, or as long as it emits a soft red glow, that's a little more calming than the blue light. And to reiterate, avoiding using cell phones or laptops in bed is the best practice, and you want to avoid watching television close to bedtime. And lastly, spend the last hour before bed doing a calming activity such as reading. So there we go. Tip number 4. Okay, so you might be asking what to do if you wake up in the middle of the night. So first thing, avoid checking the time or using the phone. And it might seem counterintuitive to get up when you so want to desperately fall asleep, but the recommendation is actually to get out of bed if you wake up in the middle of the night. If you're tossing and turning for more than 20 minutes, you run the risk of creating a negative association between the stress of not sleeping and the space that you're lying in. So consider it a reset. Go ahead and get up, go into a different room, do a quiet, soothing activity like reading a book or sipping a cup of herbal tea. You want to turn on as few lights as possible if you do get out of bed to remind your body that it's still nighttime. And then when your eyelids start to drop, try returning to bed, and hopefully you'll be able to fall asleep. So again, when sleepy, return to bed. Okay, here we go. Here are some relaxation techniques. There is also, aside from the mindfulness meditation, there is progressive muscle relaxation. So progressive muscle relaxation is one way to get your mind and body to zone out. And to try it, you want to start by tensing your toes for 5 seconds, then relaxing them. Repeat the pattern of tensing and relaxing your muscles, working gradually from your feet up your body to your neck. Or you can take deep breaths, feeling your belly rise and fall with each one. Another familiar strategy is to count backwards from 100. Whatever approach you choose, the goal is to focus on the present moment and let go of any tension or racing thoughts that are keeping you awake. And tip number 5, keep a sleep-ready bedroom. So you want to evaluate your bedroom to ensure ideal temperature, sound, and light. So this was an American poll done as to what was important while sleeping. They said that bedroom environment was super important, a controlled temperature was super important, especially cool temperature. So make sure cool room, ideally within between 60 to 70 degrees Fahrenheit. Also, you want it free from noise that disturbs sleep. So, for example, pets, if kids or partners snore. You want it also to be free from light. And if you aren't able to have your room free from light, you may want to consider blackout curtains that kind of block the light from the outside, eye shades, earplugs to kind of to block out the noise. And there are also white noise machines to help you focus on that kind of relaxing noise, such as having a fan on. You can listen to that noise as well. Okay. Again, this is the American poll that I was mentioning earlier. So 47% of people reported their sleep environment is very quiet. 57% reported sleeping on a very comfortable mattress or surface, which we'll touch base on next slide. And 36% of people describe their sleeping room as very dark. So as 57% of Americans said, their mattress needs to be comfortable. And number 6 tip is make sure that you sleep in comfort. So you want to make sure that your bedroom is inviting for sleep. We want to remove any clutter that is in your bedroom. It can cause some stress and not a relaxing vibe. And you want to make sure that your mattress is comfortable and supportive. So the one you have been using for years may have exceeded its life expectancy, about 9 or 10 years for most good quality mattresses. So have comfortable pillows and make the room attractive and inviting for sleep, but also free of allergens that might affect you and objects that might cause you to slip or fall if you have to get up during the night. Check those mattresses. Okay, so what do you guys think here? Another poll. Does alcohol improve sleep quality? Yes or no? Okay, let me give you a little moment. Okay, I'm feeling that people are saying team yes. Are you team yes or team no? Well, let's find out. So number 7 is you want to avoid sleep stealers. So alcohol, cigarettes, caffeine, and also big spicy meals are called sleep stealers. So we want to beware of these hidden sleep stealers. So alcohol actually interferes with REM sleep. And if I quiz you, you'll remember that REM sleep is one of our stage 4, which is part of our restorative sleep. So we wouldn't want this alcohol to interfere with our restorative stage of sleep here. So cigarettes, also nicotine disrupts sleep. Caffeine blocks adenosine, which makes you drowsy. And if you have big spicy meals, this can cause indigestion closer to bedtime or while you sleep. So that can cause you to wake up in the middle of the night or use the bathroom or cause you to have stomach discomfort. And that's not a good thing if you want to sleep all the way through the night. So what are our tips? You want to avoid large meals 2 to 3 hours before bedtime. And if you're hungry, you want to eat a light snack 45 minutes before bedtime. You also want to have no more than 1 to 2 alcoholic drinks before bed, and do not use alcohol as a sleep aid. Again, this is to be done in moderation, and if you need to, please talk with your doctor, as certain medications that you may be taking interact with alcohol. So I would check with your doctor on this. And you want to avoid caffeine after 2 p.m. because it could also affect your falling asleep. So you want to try herbal tea instead, or a non-caffeinated option. So are naps good or bad? Well, power naps are considered a good way to restore a little bit of your vitality here if you need it. So tip number 8 is taking a power nap if needed. But how long, you may ask? So depends on what your goal is. So for maximum productivity, here we go. What does it say? If we're going to do a short power nap, 20 minutes is recommended if you want an energy boost and you're going to be easy to wake up after 20 minutes. Make sure you set your alarm. If you do 30 minutes, you may wake up with grogginess, but you'll still be able to have an increase in mental function. If you take a little longer nap, 1 hour nap improves your short-term memory, and you may feel some grogginess, but if you take a full 90-minute nap, you will already do one full REM sleep cycle, and then you may have dreams when you do take a power nap for 90 minutes. But if your goal is to, maybe increase your creativity, maybe a 90-minute nap would be good for you. So it all depends on what your goal is and what you want to achieve. But basically, tip number 8, take a power nap if needed. And it says here to nap only if necessary. So napping an hour or two at the peak of sleepiness in the afternoon can help supplement hours of sleep hours that were missed at night. But naps can also interfere with your ability to sleep at night and throw your sleep schedule into disarray. So you want to be careful at how long you want to take a nap. Okay? So basically, you want to use naps to recharge. So naps boost alertness and improve motor performance, which is why you feel energized after taking one, and the length you nap determines the benefits. And a 20-minute snooze called a stage 2 nap is ideal to enhance motor skills and attention, while a 90-minute nap brings rapid eye movement sleep, which helps make new connections in the brain and can aid in solving creative problems. So number 1 rule is setting an alarm to make sure you get just the right amount of sleep. So napping for a length of time between 20 and 90 minutes may also help you, but you're likely to feel groggy afterwards. Okay, and number 9, which is actually really tip number 10, because tip number 1 and tip number 2, circadian rhythm and sticking to a schedule, are kind of tip 1 and 2. So this is number 9, regular exercise, or tip number 10, getting regular exercise. Vigorous exercise is best, but even light exercise is better than no activity. And you can exercise any time of the day, but not at the expense of your sleep. So the general recommendation from the American Heart Association for the average American adult is 150 minutes of moderate to vigorous activity per week. But you want to avoid the vigorous exercises close to bedtime. Some people find that doing a relaxing exercise activity such as yoga is great for a late evening activity, because this is meant to help your body relax, and can also the stretches can also help loosen your body as well to get into that relaxed mode. And light exercise, again, is better than no exercise. But the point is that getting regular exercise is a good best practice for you to regulate your sleep schedule and also get a better night's rest. All right, so here are some resources that were helpful for us to create this presentation for you here at Facey Patient Education. You can also look at these resources as well. They are free to you at the National Sleep Foundation, American Academy of Sleep Medicine at sleepeducation.org. There's also the Better Sleep Council if you'd like to do your own research too on certain lifestyle tips. And there is a TED Talk on YouTube about what would happen if you didn't sleep, and that one is pretty interesting. You can also go ahead and watch that. And of course, sleepfoundation.org, the National Sleep Foundation, is a great resource for tips and tricks on how to better your sleep. The National Sleep Foundation also has a sleep diary, so remember our tip number 1 and 2, know your body clock and stick to a schedule, know your circadian rhythm, right? So sometimes documenting in a sleep diary will kind of help you figure out when your sleep-wake cycle is. So you can find a sleep diary at the National Sleep Foundation. You can track your sleep habits over a 1 to 2 week period and also bring the results to your physician to see if there are any abnormal patterns in your sleep. And it can also let you know what your natural sleep pattern is as well. The Veterans Administration also has some sleep health tips Two, it is specific to the veteran population, but it is also very helpful, General Sleep Health 101. And if you would like one-on-one sleep coaching on lifestyle modifications, you may consider having a visit one-on-one with a health coach. We do telephonic visits here at Facey, and when we can, hopefully very soon, once COVID-19 is done, we can again see patients in person in the office, but we can do telephonic visits or a Zoom visit where it's a virtual visit where you will be able to see the health coach, and the health coach will also be able to see you. You can go ahead and call our health patient education department at 818-837-5779 to schedule a one-on-one visit with a health coach. That would be myself, Tia. And if you still can't sleep, you may want to talk with your doctor to see what could be some options for you, okay? And lastly, these are some apps on your phone. Tech is super helpful, especially now we can better track our health. You can also track your sleep. So on your phone, there are different apps. Sleep Score is free. You can also document your sleep cycle. It's also a free app. There's an app called Sleep Better as well. Those of us who love meditation to help keep us calm, this is a calm app, but you do have to pay for this app on your phone. There's also Pillow. It requires an Apple Watch and a phone, and your Fitbit. If you wear your Fitbit or Apple Watch while you sleep, it also records your sleep cycle. So it lets you know when you're restless, if you're in deep sleep. It lets you know that helpful information. And lastly, I thought that it would be very helpful for us to see. Here we go. Going back, for us to see what are the other tech that we have to help us sleep. So this website here, sleepgadgets.io, has the top 20 sleep gadgets that assist with helping people who have sleep trouble. So again, this is very optional, but some people do want to see what tech devices are out there to help with sleep. And I just wanted to let you guys know that the gadgets that are on this website address the different sleep hygiene areas or sleep health areas we can control, which are light, breathing and relaxation, maybe devices that help control the bedroom environment, also helping you track your sleep schedule, and its sound or noise reducers. Okay, so if you want, we can go ahead and look at this website here. Okay, let me exit here. All right, let's look at sleepgadgets.io. Okay. All right, so here's how the website looks at. Again, there's reviews. Again, these are some evidence-based sleep gadgets here that you can look at. There are product videos as well. But if you look at this header here, there's some for the bedroom. If the lighting is an issue for you, you can look at this. There's some sleep aids, sleep trackers, and also sound and music. So if you look at here, let's look at this Dowdo sleep aid and click. Okay. There's information, product information. There's also videos. It lets you know. It lets you know how the device works, and this is available for all of the different devices in each of these categories. So thought that would be helpful for you. Again, sleepgadgets.io, and again, all of these, just to reiterate, address the sleep health areas that we can control: light, breathing, controlling the environment, tracking your sleep schedule, and also reducing the noise. All right, and any questions, please let us know. We don't actually have an evaluation for you here since it is our recording, but we thank you so much for listening to this sleep health presentation from Facey Patient Education. And again, If you wanted, you can go ahead and give us a call. We do have other classes available as well, healthy weight management, diabetes and heart disease prevention, diabetes classes, and other patient education um, classes for all of our patients to take advantage of. So again, in order for you to know about that, you can give us a call, 818-837-5779, and we hope that this presentation was helpful for you. Thank you so much.